In this exercise video, we're going to be going to an isometric core strengthening exercise. This is great for getting our core to stabilize, to help with back pain, hip pain, and a lot of other issues. So what we're going to do is get ourselves laying on our back, and a small pillow for your head is okay. Otherwise, we want to be totally flat. We want to think about creating a straight spine position from the top of our head to our tailbone in a perfect alignment, and a very small arch in the lower back. So we don't want to be totally squished down in the lower back. We want to think about natural curves, which is a small little curve in the lower back. From here, we're going to start off with showing you a unilateral or one-sided isometric contraction. So we're going to bring our right knee up to a tabletop position. So we have 90-degree bend at the knee, 90-degree bend at the hip here. Then we're going to take our opposite hand and put it directly on top of our knee. So right leg, left hand, and we're going to give ourselves a little bit of an isometric hold. So my right knee is pushing up into my left hand, and my left hand is just stabilizing and holding. We're going to hold it for the prescribed amount of time and then relax. Press and hold for the prescribed amount of time and then relax. So you can see no actual movement is happening, but the muscles are contracting. So that's an isometric contraction. We want to think about bringing this knee and aiming for it to go straight up to our chest when we're doing this isometric here. And it's better to have your toes kind of flexed back towards your shins versus pointing straight on. So flex those toes to help give you a good muscle foundation here, and then relax. As I'm holding, I will feel a little shaking in my core, and that is okay. Keep working through the shaking as long as you're able to keep good form and there's no pain. So showing you if we were doing the opposite side, left knee up to 90-90, toes flexed, hand from opposite side giving resistance as I hold. So this is unilateral. You can do one side or both sides, depending on if you've been instructed to do so by your physical therapist. So if we want to do both sides at the same time, so we're going to do a bilateral muscle isometric hold, then we're going to bring both knees up to 90-90, toes still flexed in. We're going to crisscross our hands here and hold. So now both knees are pressing up towards my chest and my hands are resisting and holding for the prescribed amount of time. So you can see and feel some shaking in your core as you're holding. Again, that's normal and healthy. Just keep working through it as long as you don't have any pain, or as long as you can maintain the form. So unilateral, each side individually, bilateral, both together. You want to make sure when your arms are giving the resistance that they're not pulling up off of the floor and you're not coming into a crunch position. Try to still keep your head down, shoulder blades still relatively down and back towards your butt pockets, and not rounding forward.